Folks, look, the other evening, a good friend of mine and a member of the United States Senate, Senator Bill Cassidy out of Louisiana, joined me in one of my teletown hall meetings. He's a doctor. He is a gastroenterologist, and he is also, as he calls himself, a Cajun. But he did a great job of answering questions. He's joined me here for just a few minutes. A lot of the questions that came in, we didn't get a chance to answer. So what I've done is I've had my team put together a list of these questions, and we're going to do a quick run through, just one throw right after another here. And Doc's going to try to hit these out of the ballpark with a real quick answer, just to try to get to a few more of the answers to some of the questions that folks in South Dakota had the other evening. Doc, do you want to say anything before we jump right in?
No, Mike, thanks for having me. I really enjoyed the call the other night. It was fantastic. And so I'm looking forward to this kind of interview, if you will.
Okay, here we go. First one, is social distancing going to have an impact? And what will happen when we go back to normal? Will the virus just flare up again?
A couple things. It has absolutely had an impact. New Orleans, the New Orleans region in Louisiana has had a big outbreak with social distancing. We've gone from every person infecting 2 to 3 other people, to now every person infected only infects about 1.3 people. That's a huge difference. So it does have an impact. Whether it comes back, probably so. That's why hopefully, as Tony Fauci says, the NIH fellow, that we need to have a new normal. If you are at risk of being infected, you'll wear a mask. You'll wipe down the cart in the parking lot at Walmart with a Lysol wipe. You'll use hand sanitizer as you go around. If you touch your face, you'll grab your hand sanitizer and then you'll quickly wipe your fingers. So absolutely, it can come back. We need to live with the new normal.
But that new normal is not going to be forever. It's going to be until such time as we get the right kind of testing, the right kind of therapeutics, and the right kind of vaccines, right?
Absolutely, Senator Rounds. You nailed it.
Okay. Hey, I'm joined here once again, for those of you that might just be joining here, with Senator Bill Cassidy. He's a gastroenterologist. He's from Louisiana, a good friend of mine in the United States Senate. And he's one of these guys we can ask some tough questions to, and he's got some good answers. Another one, can my pet dog or cat get infected? And should I take any extra precautions to protect them?
Well, it does appear that, for example, there was a tiger in the Bronx Zoo that got infected. There was a report out of China of a dog getting infected. What's not known is, can the animal infect humans? It may go from humans to animals, but it doesn't necessarily mean it can come back the other way. So the Centers for Disease Control has kind of recommended, if you are sheltering in place, just keep your animals with you. But as a rule, you don't have to have special, special precautions. Just kind of good sense precautions. Since you're social distancing anyway, sheltering in place, keep your animals with you. And by the time you're clear of the virus, they'll be clear too.
Okay. What about herd mentality? What is it, and how will it affect us in this fight against COVID-19?
I think you're talking about herd immunity.
Yes, I'm sorry. Excuse me.
Believe me, we deal with a lot of herd mentality. I'm a Saints fan.
That was my mess up.
Herd immunity means that when there's enough people who are immune to virus, it protects those who aren't. So right now, when one person is infected, it infects 2 to 3 more. And those 2 to 3 more infect 2 to 3 more, who then infect 2 to 3 more. But if the one person infected comes in contact with somebody who's already immune, it stops there. When you have enough people immune, there's no one else to infect. Now, herd immunity begins roughly 40% of the population is immune. It really is most effective when you have over 80, but it begins when you have about 40. And so herd immunity is real. We've probably got a ways to go before it kicks into our society, but that's the ultimate goal.
Yeah, thanks. I think when I was thinking of herd mentality, I was thinking about how we talk about the House of Representatives in Washington, D.C. Hey, when should we wear masks, and when is it safe to not wear them again?
If you're in a confined environment, wear a mask if you're with other people, and you cannot avoid being closer than 6 feet. So think of the bus drivers in New York and Philadelphia getting so upset. People would come right by them all the time. They're in a bus. That air is just kind of circulating around. They should wear masks. But I have an assistant across the room. He's 12 feet away. There's plenty of good ventilation where we are. I'm not wearing a mask. When I walk with my wife, I don't wear a mask. But I went to give plasma yesterday, surrounded by people kind of videoing as I gave plasma. I wore a mask because they were close to me in a small room. Kind of use your judgment.
Great. What about, is there anything that we should do to strengthen our immune system during this time? Anything in particular that stands out?
There's the good advice of rest and a good diet, but risk factors for getting a severe case of COVID-19 are being obese, having high blood pressure, and diabetes. Those are all related. This might be the time to start your diet, in which you lose a pound a week. If you have social distancing for 12 weeks, you've lost 12 pounds. Simple diet, if it's white, don't eat it. No white sugar or brown sugar, no white potatoes, no corn, no grits down here in the South. Salt, don't take salt, don't take white flour. You can eat sweet potatoes, whole grain bread, brown rice, but no sugar of any kind. If you cut out all that which is white, then you're going to lose at least a pound a week. And by the way, no cold drinks with sugar in them. Become a label reader. No cereal with a lot of sugar. But if you do that, you'll lose a pound a week. At the end of this, you'll have lost 8 to 12 pounds and be on your way to improving your health otherwise and decreasing your risk for severe COVID-19.
I'm sure glad you didn't say anything about beer being white.
Beer has white in it, by the way. A lot of calories in beer.
Well, that might be a lost cause for some folks then. Okay, what about zinc? There's a rumor out there that says that zinc can be effective in combating COVID-19. Any truth to that?
Well, I can't say that it's not. There's just no strong data. So what you want to do is give zinc to half the group and zinc not to half the group and see which group does better. So there's no data out there, but a zinc supplement's not going to hurt you and it may benefit you. So it wouldn't. So why not?
What about hydroxychloroquine? It's used for malaria. There's a discussion out there. As a matter of fact, we're doing clinical trials here in South Dakota involving over 2,000 volunteers, 3 different hospital organizations. What's the current thought process with regard to that particular product?
It may,
Hydroxychloroquine.
it may benefit. It's not yet proven. It can have side effects, particularly with heart arrhythmias. And so discuss it with your physician and let your physician help you work through that decision. There's some people who just shouldn't take it. But there is some evidence that if you are on it, that it protects you from being infected. So let me just go back to discuss it with your physician. If there's a clinical trial, enroll in the clinical trial. That's a good way to advance medical science and to get some of the benefits that you kind of want if you're going to take it, and let others know as well whether there is benefit.
I would note that the FAA has put out a notice to pilots saying if you do participate or use that product, you should not fly for 48 hours after you've used it. That just came out recently.
There is a heart arrhythmia aspect to it, and you don't want your pilot, suddenly going into a heart arrhythmia. So I kind of get that.
Okay. What about the vaccines? How close are we? I know that, Steve Daines, another one of our members in the Senate, really good guy, really sharp guy, had promoted, and a lot of us bought into the idea that we try to promote kind of a 2 paths at the same time, trying to develop clinically the different vaccines, but at the same time, start producing the vaccines in large quantities at the same time, just in case one of them is effective, to be able to have those vaccines available perhaps 5-6 months earlier. What do you think about that?
Yeah, I think it's a great idea. I'm glad Steve suggested it, but we're still 12 to 18 months from that vaccine being available. You have to first know that it's safe. Some vaccines cause problems. Then you have to know that it's effective, which means that you give the vaccine to a lot of people, you give a sham fake vaccine to another group, and you see whether those with the vaccine are actually protected against the second wave of coronavirus. Now, you're really talking through the next season. That's why it's important to have a knowledge of our immunity now. It may be that some have already been exposed and are already immune. They've already been vaccinated, if you will. So the vaccine is 12 to 18 months off, but it would help for all of us to know our immunity status now and follow that over time to see if we become immune over time.
Okay, look, and Doc, I know you've got a number of other items going on. I'm not going to keep you much longer. There is one in here that I think is important. What about going to your doctor for non-urgent, non-COVID-19 related visits? And how should we really handle that with regard to those other issues that normally we'd call the doctor or we'd go and we'd stop on in? what's really the protocol now for the next couple of months anyway, with regard to how we should make contact with our doctor and the precautions we should be taking, and when should we make that contact if it's not really COVID-19 related?
Several things about that, Mike. In the CARES Act that you and I just voted for, we expanded the use of telehealth, meaning that you can call your physician, she can look at you over a smartphone and get a sense, oh, that rash, I can tell you what that rash is just from looking at it with the smartphone, and then we call in the prescription. So some of what we formerly saw our physicians for can now be done through telehealth. The physician can also order home health to come see you, so you don't need to come in. So they can bring a blood pressure monitoring equipment or something to put on your finger to monitor your pulse and the amount of oxygen in your blood. That sort of distance analysis, if you will. On the other hand, in the instructions the president gave yesterday, the president said that if you have elective surgeries, they're going to open that back up. I like that. Physicians, dentists, we're used to practicing universal precautions. You'll walk into the doctor's office, everybody will be wearing a mask. There'll be hand sanitizer at the waiting room. When people walk in, they'll wipe off the chairs as they get up to go into the back. All the physicians and dentists, nurses, techs will be wearing gowns. We're used to those universal precautions. I think that's a good way to begin opening the economy back up.
Great. Look, we've been speaking with Dr. Bill Cassidy, a United States Senator from Louisiana, a good friend. He is a gastroenterologist professionally, but he's been a real asset in the United States Senate and become a very good friend. Bill, I want to thank you for taking a few minutes to speak once again with the folks here in South Dakota. We just thought it'd be good to have a professional come in and answer some of these questions that we didn't get to at our teletown hall the other evening. Thank you very much for helping us put this together today.
Hey, Mike, we're all in this together. If you want to have another one of these, I really enjoyed it. And let me compliment the people of South Dakota who called in. Y'all had great questions. In fact, what I'm going to do, Mike, if you don't mind, is kind of link from my Facebook page to wherever you post this so that folks in my state can have the advantage of the questions asked by the folks in South Dakota.
Sounds good. Hey, thank you very much. Like you say, we're all in it together. We're going to win this battle. And we're going to come out stronger as a nation than we were before. Thanks.
Thank you.